Back, New York State's child care sector is facing significant challenges, including staff shortages, high costs, and limited availability, all further exacerbated by the pandemic. In response, the state has made efforts to improve access to affordable child care with a $50 million investment and a focus on equitable, high-quality early childhood education. Joining us now, the Commissioner of the Office of Children and Family Services, Dr. DaMia Harris-Madden, and we thank you, Dr. Harris-Madden, for being with us.
Well, it's a pleasure to be here, and thank you.
Thank you. A much needed conversation. And when we talk about the state of child care right now, obviously for the average person, that struggle is real. It gets, it's more burdensome with economic times. Just from your lens, how do you view the child care situation?
From my lens, which is a parent of three, I will say that child care is a necessity. It is an absolute must for us, not only in New York State but throughout the nation, throughout the world. And I have to say, in my short time here as the new commissioner of the Office of Children and Family Services, I am in awe and I'm extremely proud of what has been invested into the system. The governor has invested in 4 years, $7 billion to support our child care assistance programs. And so we can talk a little bit more about that, but just viscerally, my reaction is I'm excited. I'm excited that we're on a path to universal child care, which, other countries afford to their constituents, and New York should be no different. But that obviously takes lots of work, it takes lots of resources. And so we're here for it. We're ready to, move the needle. And I think we're doing that by investing in the way that we have.
Well, talk to us a little bit about this because you're talking about affordability, right? And we know that many families really struggle in this area of affordability. How is the state able to assist and deal with the fact of the affordability crisis?
Certainly. Well, let's start with the fact that under the governor's leadership, we've been able to raise the federal maximum eligibility piece, right? So there is now, in comparison to the past, 85% of our state median income, which is used to determine eligibility. So what that means is that a family of four earning $108,000 has the ability to have access to child care capped at 1%. So, back when I was raising my children, I didn't make nearly as much as $108,000. And, we were looking at the 40s in terms of income levels. Again, today, this governor has made sure that this is more affordable for working families.
And for yourself, obviously, pretty new to the job, but yet and still not new to the issue at all. And I know that there are these deserts out there, child care deserts. How is the state tackling the fact that we've got these child care deserts, and what are we doing about it?
Certainly. So, throughout the years, there have been investments to build the capacity for places throughout the state that are clearly child care deserts. There's been infrastructure grants. There's more in this current budget to the tune of 110 million for childcare construction and expansion. We know that we no longer have wait lists across New York State. Yay! I have to tell you, that's really exciting because when there's long lists of folks waiting to get into the system and access care, that's a problem. That means parents are having to make the choice and are forced to make the choice between work and staying home. So, the fact that we have increased the numbers in terms of in our CCAP program, for example, we have, I think, about 34% of an increase of children that have come into the system. And I know BronxNet reaches, your native Bronx folks. And so I want to just point out to you that, of the 100,000 across the state that are accessing care, the Bronx has the highest number of child care programs out of all 5 boroughs. So that's something to applaud and something that's exciting as well.
Yeah, and to know that we have that many child care programs, the need is definitely there. I want to take a moment, if you will, and just switch gears for a moment. Talk a little bit about the work that you're doing with child Child Protective Services. That falls under your umbrella as well. And as you look at Child Protective Services, I know you haven't been there for a while, but when you look at the state of Child Protective Services, what do you see?
I see a system that's filled with really dedicated individuals. As you know, we have oversight, so we're not exactly boots on the ground. But given my experience in the local and county governments and now coming to the state looking at this, I have a much better understanding and lens. I'm not a social worker by background, by the way, but I absolutely support the workforce that is working with our children and families. I think that there's always room for improvement. I have to say, in New York City, I've seen a lot of inroads that are made, particularly with parents and acknowledging that they should be informed of their rights. I have a big advocacy background, and I don't want to go there because I'm in another place. But I will say to you that we are absolutely rooting for and advocating for our children and our families coming into the system. As a matter of fact, I'm really proud that the governor has increased funding for some of our CACs, which are child advocacy centers, to the tune of $9 million additional dollars, which is like 176% increase, which is crazy, but it's necessary because what these child advocacy centers do is provide a safe environment for our children and families that have a multitude of challenges, but more importantly, have been subjected to some of the most heinous and egregious things. And so, what the CACs do is really support with a multidisciplinary team comprised of mental health professionals, advocates, and victim assistance services, to really provide a child friendly environment so that young people, I say young people interchangeably with children, but also their families are not re traumatized over and over having to tell their story. So that's just one example of where the governor is placing funding to further support. Right now, we have about 62 of the child advocacy centers, might be off by one or two, but the fact that we're expanding in that area really signals that we're trying our best to make sure that if a young person comes into our system, particularly those with higher acuity and needs, that they're being serviced and they're treated with respect and with a trauma informed lens.
Yeah. You talk about trauma, mental health is really a critical thing, particularly coming out of post-pandemic, New York State being the hardest hit. When we talk about mental health, how do you approach the issue of, the mental health and the well-being of our children?
Well, again, proud moment coming into this system and advocating for mental health and after school. I come from an area like the seventh borough, right, in Westchester County, where we introduced mental health and after school. The governor has done the same here in the state. That's really critical. And I'll start there because we entrust our after school professionals with our children. And in many instances, it's an extended family. And to embed and to have those types of supports, because the reality is not everyone working in an after school setting is, equipped with all the tools needed to address mental health. So we're really happy that we now have funding not coming through my agency, but through the Office of Mental Health to support in school and after school mental health. We also know that youth mental health first aid training is critical. Again, not in my department, but I'm a huge supporter of this because it empowers our young people to seek their peers, to have supports, but also the adults that typically don't deal with mental health matters. They receive training there. Another area, not in OCFS, but very close to, which is the clubhouses, which is offered through Oasis, and that addresses both the mental health and substance use, which we call co-occurrent disorders. I'm going to also just do another plug for OCFS, in that we have some increases in this year's budget that would seek to improve positive development and more investments in youth sports programs. So how does that link to mental health? We know that when young people are engaged in positive things and they are, having caring individuals during unsupervised time when their parents are at work, that, they have those outlets. They have not just sports. Sports is important, and we're glad that there's an investment in that. But along with that funding comes the education on nutrition, on health, well-being. So when we talk about mental health, we cannot extract that from the term of overall wellness, well-being, and that's physical, mental, emotional, social. And so, the governor has introduced Unplug and Play. And what that means is she's investing money into the parks departments so that, we can expand opportunities for young people to get off their devices, which we know is linked to mental health, and get outside. Investing in New York Swims, that is affording huge opportunities for particularly young people of color. Because I have to say that many of us do not have access to swimming pools, we do not have the funding for swimming classes, and just water safety. So all of this is connected to wellness and health, and particularly providing outlets for mental health. And I said a lot, so I'll stop.
Yeah.
But it gets me excited.
I got a couple of minutes left, and before we close out, I do want to get you an opportunity to talk a little bit about looking down the road in the calendar for you. What can we anticipate coming out of your office in the short term?
So, we're continuing to swing the bat for childcare. We know that we have to take the next step in terms of figuring out how can we afford universal childcare. Again, we believe it's our right. I know elected officials believe in this. The governor absolutely believes in this. We're looking at economists, taxonomists, people that can get us to a place where we can figure out how to fund these types of opportunities. I mean, we can't continue to look to New Yorkers alone. So we need to really find those experts, and that includes some childcare professionals as well, to help us path a way forward so that we're not talking about childcare in the near future, so that we can rest assured our children will have slots. And so by building in, funding for capital projects and things of that nature, really the building blocks towards universal health care. In addition, we're working with our young men. Of one passion of mine is fatherhood, and looking across our system and our system internally to look at the young men who have had some disadvantage and ill opportunity in life, just really equipping them with some of the things that they need. But again, going back to this year's budget, we are looking forward to implementing more opportunities for young people to be engaged offline and addressing some of those underlying challenges that they have.
Yeah. Dr. DaMia Harris-Madden, Commissioner of the Office of Children and Family Services, New York State. Thank you so much for being with us. Great conversation. Obviously, we love to have you in studio, but we'll see you soon.
Yes, you will. Have a great day.
All righty. You take care. Now, listen, if you want more information, visit her on the website at ocfs.ny.gov. You get all the information you need right there. Don't go anywhere. We got more open coming up. We'll be back right after this.